Hello and good morning to the Avaamo fireside chat today with Dr. Neil Ray from Duke. Good morning, Dr. Ray. How are you?
Morning. How are you doing, Kunal?
Very well, thank you. So today what we'll be doing is talking to Dr. Ray in terms of his opinions on the impact of conversational AI within the healthcare industry. And we've got a really great conversation lined up for you guys. Quick disclaimer, Dr. Ray is here out of the kindness of his heart. We're not paying him, and he's not really speaking for Duke, but, he knows his stuff. He's excellent in terms of, in fact, he'll tell you what he's doing. But, Dr. Ray, we really appreciate your time here today. And a quick one about Avaamo. So what we're trying to do is using conversational AI, looking at how we can really reinvent the way healthcare talks today, whether it's for your patients, for your guests, whether it's for members on the payer side, internal admin staff, stakeholders and suppliers. What are the best ways we can really look at using conversational AI and automation to ultimately drive patient satisfaction, improve revenue, cut down on costs, but most importantly, how do we help make sure we can keep patients happy and healthy? To Dr. Ray, thank you again for today. It's great to see you. If you wouldn't mind just giving us a quick introduction to who you are and what you do.
Thanks for having me, Kunal. It's always nice to be able to talk about innovative technology in the healthcare space. So I'm a practicing physician, anesthesiologist to be specific, and a pain management fellowship trained. I have a background in biomedical engineering, and I have a master's in management in clinical informatics from Duke. I'm also finishing up my MBA with a concentration in finance and business analytics. I'm interested in basically innovation in healthcare, particularly technology focusing on telehealth, machine learning, conversational AI, to name just kind of a few. And these are the projects I'm currently involved with and working on.
Nice. It sounds like you have a lot of spare time.
Oh yeah, tons of spare time, especially with COVID now.
Yeah. Well, talking about COVID and, we all had a bit more of a life beforehand. So just to get to know you a little bit better, what are the kind of things you like to do in your downtime now?
Yeah, things have really changed, haven't they? So, we used to love to travel. Obviously, that's been curtailed quite a bit. And, the main driver for that was, to be able to expose our kids to lots of different cultures and experiences. But I guess there is a little bit of a silver lining with COVID. We're able to spend more time at home with my family and two kids when I'm not clinically working. And quarantining has been nice in a way from that standpoint.
Yeah. Okay, great. And so we are here today, and we appreciate that. And I think a lot of us are in a similar boat, especially. Well, that's, the good thing is being able to spend a lot more time with the family and the kids.
Correct. Yeah.
And I heard you play tennis too, so that's great.
Yeah, well, I used to a lot more, right? I was much better in my younger days. But yeah, as much as I can now.
But to kind of more pressing matters at hand, or as the case may be, slightly less. But we are here to talk about conversational AI and the impact it's having on the healthcare industry today. So in your opinion, Dr. Ray, what do you think are some of the biggest challenges facing the healthcare industry today?
Oh, that's a simple, easy question, isn't it? Not broad at all, huh? Healthcare, it's an interesting place. It's not as fast moving as other industries, I would say, like banking or finance, but it's slowly getting there. Traditionally, healthcare has been a little bit more siloed with each department or division kind of doing its own thing. But that's also transforming and it's transitioning. We're transitioning from just being and doing interventions to taking care of populations as a whole. So that's the whole population health initiative and movement. And it's really the prevention of disease that is really the next transformation in healthcare.
Okay. So given that, how do you think and how do you feel that something like conversational AI could actually create an impact, and what kind of benefit do you think that could have?
I think there's a lot of benefit that could happen with conversational AI in general. The main concept I see is engagement, right? The more interactions we can have with our patients, the better. But unfortunately, we don't have the manpower or the staffing to really do that. So that's where conversational AI could really help us in be able to engage with our patients more. Engaging with patients, across the entire continuum is possible with conversational AI. You could start with patient registration, appointment scheduling, clinic check-in. There's a lot of different interactions that we can do with our patients that we just currently don't have the manpower for.
And in one way, it's great to say, yes, we'd love to use something like this for the purpose of engagement with our patients, but do you feel there's a real ROI, a return on investment from any of the healthcare organizations who may look to invest in this kind of a technology?
I think there is, and there's different ways to look at it, obviously, right? You can have a financial ROI, right? So is it going to help the bottom line in one way or the other? And there can be, obviously, a patient-related healthcare ROI, which can have downstream financial positive implications. We can start with, the financial. Healthcare centers, particularly during COVID now, call centers can become overwhelmed with patients calling in about symptoms or other issues. So conversational AI really has the ability to allow people to shift work to the top of their skill level, right? We had to move a lot of people to the call center, for instance, and other health centers did too, but it's not probably at the top of their skill level. And so you can take the conversational AI into that call center and then shift people into more productive places. Patient related, right? Engagement and experience are really what matters. And you can imagine ways where health centers can create value that way. And I would argue actually down the line can also have financial benefits. We can come up with an example of a heart failure patient, for instance. You can have a conversational AI that engages with that patient, maybe connected to a smart scale, and it can engage with them and see if they're increasing their weight on a daily basis. The conversational AI can engage with the patient and see if they're adhering to their medications, has their diet changed, et cetera. And so down the line, obviously, that can have a huge financial ROI of limiting hospitalizations. But in the short run, it has a patient-related engagement kind of ROI that you see.
So to potentially challenge that question, why couldn't, let's say somebody has a smart scale, why couldn't an app just have sufficed for that?
An app is a little bit more, I guess, rudimentary, I would say. You want something to be able to engage with a patient, and you're not trying to trick the patient in any way to try to say that it's a human being, but you want some type of real-time interaction that can deviate and that can understand variations based on what the patient is saying. There could be nuances that come about, or the patient may indicate, hey, something else is really the problem. Conversational AI, I think, has the ability to be able to navigate those more so than kind of a strict script-based app type technology.
Interesting. And that helps, and especially as you're talking about, its use, let's say, within a contact center. Do you see, a lot of application of this in maybe like a patient scheduling environment? And if so, could that actually work?
Yeah, I think there is tremendous potential, actually. Taking a step back a little bit, health systems, they're increasingly using analytics now, and we're transitioning to use technology more and more. And we're using analytics to help us make decisions. So I'd first recommend, an analysis of the types of calls that kind of come in first to a call center and to a health system to see where the biggest gains really are. Scheduling, for example, might be the initial use cases that a health system looks at, but it could be other things as well. But first, identifying, what are the biggest needs, what are the biggest patient touch points that are coming in is really the first way to look at it.
Yeah. Okay. Why do you think, that's the kind of how we may look into it and that it could make a difference, but why do you think, what kind of impact could that actually really have?
Impact in what exactly?
Impact, both from a patient experience perspective, why would they want to call in and speak to a virtual agent, and maybe also from, the contact center perspective, why would they want to replace a human being with a virtual agent?
So I think part of it is you can have standardization and efficiency, and that's part of the kind of benefit of a conversational AI that is deployed throughout a health system, where you can have similar types of answers for similar types of questions that come in. Like I said earlier, you can have people then focused on the actual physical engagement with patients or more complex things that a conversational AI can't do. And that's where you need people involved. So you can have the call center people involved in more of those complex situations, whereas some of the simpler ones or the ones that are just a little bit more routine can be given to conversational AI.
Okay. And that helps. So when it does come to conversational AI, maybe outside of the scheduling for booking an appointment, canceling or rescheduling, etc., what are some other interesting use cases for conversational AI that you could see being applied in the healthcare world today?
There's a lot you could do. You're talking about the initial interaction with patients and the conversational AI. And so a lot of those involve anything that a patient might be calling in about, right? So from the scheduling standpoint to the billing standpoint, to questions about symptoms, you're obviously not getting to the diagnosis part of it, but there's a lot of patient and health care related interactions that you could have. And then outside of that, you can have obviously research recruitment and follow-up, procurement of medical supplies, electronic healthcare IT issues. So there's a broad array of use cases, not just in the patient and healthcare setting.
Okay. And how do you think patients would feel when they are calling in and maybe speaking to a virtual agent versus a human being?
How would they feel? I think it's important to, be upfront about it, that this is, you're not trying to trick anyone and say that this is an actual person. And I think it will vary, obviously. I think if the quality of the interaction is good and it ends to the result that the patient is looking for, I think it's going to become more acceptable. And you can see that in, like I said earlier, with the financial institutions or banking who have really kind of started the progression of conversational AI. Right now, I don't want to go and talk to a banker if I can check my balance or deposit or whatever it is through a conversational AI agent. It makes it much more streamlined, faster, so that I don't need to, go into the bank or even talk to someone on the phone. That's a real life human being.
Okay, so given what you said and the fact that Duke is one of the top healthcare institutions in the country, if not one of the best in the world, what are you guys actually doing right now in terms of conversational AI? Are you
So we're evaluating the marketplace right now. We're kind of finishing up, our internal use case development stage. Like I said, you first want to see what are the gains that you can have. And what are the different use cases that might be useful. And so we're kind of finishing that up. And then we're doing a broad kind of vendor analysis to see what the market really holds. That's kind of the stage we're in right now. So we haven't deployed anything. We haven't picked anyone. We're kind of in the early stages.
Okay. So given that and what you said, and I know you're obviously evaluating a number of conversational AI vendors and partners. So could you tell me what it is that you have been looking for, but also, maybe if another health system is also evaluating conversational AI vendors and their use cases requirements may be slightly different from yours. So it'd be great to understand, what you specifically been looking for, but also what should other health systems consider and take in mind as they evaluate the landscape.
Sure. I don't want to necessarily, speak for what others, might look for exactly, because obviously it's not a one size fits all situation. But I think first health systems should look at what their internal capabilities are. So some places have really robust IT infrastructures with all the required manpower and expertise for machine learning and natural language processing. And there are others that don't have that. So first, it's really seeing, what kind of capabilities do you have internally? And I think that'll start influencing the vendor selection process. Next thing I think is, most health centers have, a request for proposal, process, RFP process. But with technology moving, so quickly, I think one of the most impactful things is seeing it in action. So if vendors can demonstrate their capabilities, that gives a bit of a more reassurance, I think, in my opinion. And lastly, I think it really depends on how expansive a health system or university wants to be. There are many different conversational AI vendors that are out there. And from my experience, some are very kind of focused. Some focus on just health or IT or just human resources. And there are others that are more expansive and have expertise in a broad number of domains. So it really depends on what the health system is looking for and if they want something more focused or if they want something really broad.
Would you say it's probably a good idea to maybe consider vendors that already have pre-built skills or capabilities for like a range of the use cases you're looking for? So you can see, they've already had that experience.
I think yes, if there are pre-built skills, I think that always helps in a number of different ways. It helps that because you can see that this was done at other institutions, but it also helps, I think, probably with speed to deployment if that's an issue as well. But again, having the skill, but then actually showing that it can work with your IT infrastructure is probably the best way to really scope it out.
Okay, perfect. So, and I appreciate that. Thank you for that. So, given what you've seen and what you said so far, and you've talked a little bit about what you are looking to do, and how you're looking at selecting a vendor, and obviously this landscape moves pretty quickly. So, where do you see something like conversational AI could be in 1 or 3, 5 years from now?
Yeah, I think it's only going to get more clever, and progress just more rapidly. You can imagine where sometimes you might not even be able to tell that you're talking to a conversational AI versus a human being. So I think it's just going to move more rapidly. I think it's going to integrate more systems. And that's really the goal. You don't want conversational AI that's just kind of siloed by itself. You need it to integrate with all the different systems that you have and talk with. You guys can probably tell me more, honestly, based on the number of inquiries and partners, you and other companies are probably seeing on a weekly basis.
That's right. So given that you said, it's really going to evolve, get so much better over the next, few years, why shouldn't we just wait for another 2-3 years till it's at a, more evolved state, shall we say, as opposed to doing anything now?
Yeah, I mean, it's a good question. I think part of it is that there are benefits that you can get right now. And you can imagine you don't need something extremely complex for certain use cases. And the conversational AI technology is already very good for certain use cases right now. So there's a gain that can be had, a patient experience factor, a ROI from a financial standpoint. I think those already exist. And so that's why it's a process now where you can start it and then evolve. Your health system or university can evolve with the technology as it progresses.
Okay, thank you. So we're nearly out of time soon. So in terms of a quick summary, Dr. Ray, so what you've effectively said today is, you do see a lot of value in conversational AI in the healthcare space, whether it's affecting the patient experience, making their lives a lot easier, more interactive and more engaging. They do feel like they get better value and information from that conversation than maybe an app, as opposed to even speaking to a human where, maybe a human may be slightly judgmental sometimes, or at least you've still got to wait for 5 to 10 minutes sometimes before you get to a human. So maybe, that's the patient side. And then on the healthcare side, there's obviously pretty large benefits in terms of cost saving due to the automation because they're not having human capital involved in that. But on the other hand, if we are reassigning the human capital away from these kind of repetitive banal tasks, they could maybe potentially be engaged in more revenue generating material as well. For example, would you say a decent use case could be reminding or making sure patients actually turn up to their appointment? So reducing that no-show rate, which especially in this COVID time could help eliminate the lost cost from no appointments. Would you say that's a relatively accurate summary so far?
Yeah, I think humans are obviously beneficial, and you want them doing complex things that currently technology can't do. And those complex things can be done by humans in obviously an efficient way. And that's what we should kind of strive to have our people do. And we can leave the conversational AI to the things that are more boring or mundane, and that don't engage our employees as much.
Okay, thank you. And then given that, so maybe a slight step away from conversational AI, but within the whole AI theme, Dr. Ray, when do you think you will be replaced by a robot or AI?
Oh, that's a interesting question. Luckily, patients, want more than just information and dialogue currently. I'm lucky enough to be in a specialty where we have to use our hands quite a bit, and it's very fast moving and fast paced. But you never know. Things are always progressing, and I think the important thing for healthcare is to transition with technology. And the best combination is working with AI and having human AI working together. I think that's going to be the future more than anything.
Excellent. Well, Dr. Ray, thank you very much for your time this morning or this afternoon, depending on where you are. We really appreciate it. And we are open for questions now. Please do let us know. And again, given the timing, we may not be able to respond to every question today, but someone from the Avaamo team will reach out to you and get back to you if you have any other questions. If anyone would like to see any demonstrations from the Avaamo perspective of how we handle a number of the use cases Dr. Ray has spoken of, from scheduling to patient engagement, again, please do let us know. Otherwise, hope you're all happy, healthy, and we look forward to the next time. Dr. Ray, thank you again.
Thanks, appreciate it.
Thank you, Kunal, and thank you, Dr. Ray. Hey guys, this is Manu Prasanna. I'm a conversational AI strategist here at Avaamo. We are going to do a webinar on how to improve patient scheduling. So this is going to be on December 9th, 2020 at 10 a.m. Pacific or 1 p.m. Eastern time, depending where you are. Look forward to seeing all of you on there as well. Just a quick word from Avaamo. Avaamo is reinventing the way businesses talk all over the world, and we're certainly doing it in healthcare. And this talk was all about that. And if you guys want to learn more, please visit www.avaamo.ai. That's www.avaamo.ai. So now we have collected some questions for Kunal and also for Dr. Ray. So Kunal, are you ready with some questions we've collected?
Yes, I am. Thanks, Manu, and good luck for your next webinar. In fact, talking about future webinars, and it actually ties back into one of the questions that we've got, which is really focused along, like, as a hospital looking to adopt conversational AI, where do we start? So first of all, Manu actually did a great session earlier this year with one of the lead principal analysts at Forrester called Intelligent Virtual Assistants in the Contactless Economy, the New Normal, where they really go into a lot of depth in terms of also being able to help choose the right technology for an intelligent virtual assistant. So, coupled with what Dr. Ray said today in terms of what they're looking for, plus the kind of top advice from Forrester's principal analyst in terms of the kind of core elements to look at, that's probably a good place to start. But in a nutshell, you really do want to look at the whole range of technology the vendor has to offer. Like Avaamo, do they offer both text and voice? Is it HIPAA compliant? Do they have a range of pre-built skills for your specific use cases? Or does a company have to go out and build all of that? Do they have the right integrations into your backend systems like Epic or Cerner or Change Healthcare, into provider databases like Kairos? But do they also integrate into a range of other systems like your Salesforce and ServiceNow, Workday, etc., for a range of the other use cases? And then I think finally it's also quite important to look at that pricing model. Is it a pay-per-use, or is it a much more kind of simple, disruptive pricing model that's just easier for your organization to scale. So kind of that's stage one when you're coming to look at how to adopt a conversational platform and where do you start. But then specifically as a hospital, where you'd want to start looking at is probably start looking at your patient line, your contact center. How many calls do you get per month or per year? What are your top call drivers? So actually quite a number of our providers, we've worked with them to do that analysis, and we've seen that, hey, you know what, 30-40%, even more of those calls are all around appointments. So scheduling an appointment, confirming, rescheduling or canceling an appointment, getting directions to that appointment, getting a fax number, and maybe finding some information on what might be the best place to park at that particular location. Other use cases have kind of evolved from there, but looking initially at that contact center, what are those top call drivers? That's pretty easy for us to automate because we can do that either in voice or in text. And then it's really looking into a number of other areas. So, if we're looking at an authenticated experience with, say, something like Epic, particularly easy things, let's say for Avaamo, and ones that we've already done, are automation, like I said, of appointments, getting test results, messaging your provider, having patients easily manage their medication, including refills and dosage, pharmacy preferences, updating allergy, which can get added to an Epic work queue, resetting your MyChart or Cerner passwords, patient registration, updating insurance. And one of the things we're actually doing most recently, even just today, we had an email from one of our providers that the number of COVID tests are massively increasing. The number of calls they're making on a daily basis to let people know about their positive COVID tests has increased threefold over the past few weeks. So if we can help automate those calls or text messages or any level of engagement, even if it's deployed on a channel like Alexa, really just helps alleviate the pressure on the contact centers in the hospital, but at the same time allows patients to get all the information they need at their fingertips. So that's probably the best place I'd suggest for a hospital to start looking at. And then the next question, so I'm just conscious of time. Next question actually is for Dr. Ray. This is interesting. So Dr. Ray, it's great to see a doctor who's so enthusiastic about technology, but what actually drew you towards this greater interest in technology? And like today, you're pretty well versed in conversational AI. So how did you kind of get so well versed in conversational AI and technology in general?
Yeah, I've always been interested in technology, but what kind of started me on this route was a little bit of a challenge from my chair to look at innovative ways that we could implement technology into healthcare. And I actually took a course on machine learning business applications through MIT, and that kind of started the machine learning aspect of it. And obviously part of machine learning is natural language processing. And so it kind of, made its way through from machine learning to natural language processing to conversational AI. And that's kind of how I really got into it more.
Okay, great. And I think we're out of time now, and we do have a range more questions, so we will be able to share these and publish these as well. Any additional questions, please feel free to check us out. As Manu said, avaamo.ai, we've got a healthcare page, or feel free to give us a call or contact anytime. If you have any further questions for Dr. Ray as well, please send them through to us and we'll get those across to Dr. Ray. But Manu, thank you for setting this up today. Dr. Ray, huge thank you again today for all of your time, and wish everybody else, a lot of health and success, and wash your hands. Thank you very much.
Thanks.
Thank you, Kunal and Dr. Ray. Fantastic fireside chat. Thank you, everyone.